And welcome back. We have our farm to home segment this morning, as we have been talking about, and we have registered pharmacist Thomas McDowell.
All right, glad to be here, Sandra, and
So glad to have you here.
excited to have our farm to home segment. This is our first episode, and
It is.
looking forward to bringing the latest and greatest in pharmacy education, information, and advice from your local pharmacy directly to your home. So,
Exactly. And you're located inside the Boyce Willis Clinic.
Yep, at the Rocky Mountain Medical Park building, and often called the Boyce Willis Clinic.
Right.
At 901 North Winstead Avenue, Suite 100. That 5-story
Yes.
brick building is usually how I'll describe it. And
Right.
if you go in the door, we're immediately to the right.
I was
You'll
going to
see
say
our signs.
it's easy access.
It's easy access, not a lot of signage outside, but once you find us, the convenience is pretty evident, and a lot of
Yes.
providers in our building, and we service the whole Rocky Mount area and the surrounding community, so we're really excited.
Rocky Mountain Medical Park Pharmacy, and we can shorten that to Medical Park Pharmacy. So you're going to be coming on the first and third weeks mornings, Wednesday mornings, each month. So folks, we hope that you will get your questions ready. Thomas is really willing to answer any questions about medicines. That we don't want to ask him questions about medical conditions. We want to talk about pharmacy. That's what we're here to talk about, and your medicines. And Lord knows, you know, we all have a lot of questions about that, because there's a lot of things we just don't know. So today, Thomas, I believe you're going to talk about shingles. Listen up.
Yes, so shingles is a condition that most everybody has heard about, or either knows somebody who's suffered from shingles, or you yourself might have had a case of shingles. So we're going to dive into kind of the background, the presentation, and then treatment options, and also some insurance coverage issues, which is something we see every day in the pharmacy. So that's always pertinent. Cost is always a concern, and we want to help provide, great health care at an affordable cost. So shingles, to start with, it is a virus. It's the herpes zoster virus, and it is the same virus that causes chickenpox. And so the surprising thing that most people don't know is that 99% of the population has the shingles or chickenpox virus, same thing, already in their body, whether you really remember having chickenpox or not. So I'll have patients say, well, I don't think I had chickenpox, but if you look at the numbers, 99% is a pretty big number as far as the population of who's had chickenpox. So most people have that virus.
So it can lay dormant.
That's right. And
in your body.
Yep. And so if maybe you had a mild case of chickenpox, or it really wasn't even very evident, or it was confused for something different,
right?
That virus is now living inside of you in a dormant stage until it can flare up as later on in life it flares up as shingles and not as chickenpox. And so shingles can be very painful. There's different severities, of course, mild and all the way up to very severe and painful cases, but usually presents itself as a rash and blisters, usually one-sided, sometimes around your face and eyes, sometimes right here around your trunk, and then even in the lower extremities.
And that's not good when it gets around your face and eyes.
No, and it can cause some vision problems and watery eyes and even long-term issues. So if you're having any of those symptoms, make sure you talk to your physician, and so that it can be diagnosed, because it sometimes can be confused with other rashes, and you want to know what you're dealing with before you figure out a plan of treatment and action. And so 1 in 3 people will actually get shingles in their lifetime. So 1 in 3, think about that.
That's pretty tough.
And so it's not something that you necessarily want to just ignore and roll the dice on, because once you talk to somebody that's had it, they'll tell you you don't want any part of it.
Yes, that's what people always tell me.
And so it also we talked about kind of the physical appearance of it, but it can cause a lot of burning and itching and just nerve pain.
Because it works on the nerve endings, right?
So it kind of lives in the base of your nerve system, and it flares up and reaches the surface of the skin,
Right.
and it can actually cause some damage to the nerve, depending on how severe the case is. But it does, it kind of aggravates the nerve, and that's what you're feeling when you feel that burning and that nerve pain versus your typical dull ache, from a bruise or arthritis or inflammation. So it's a little bit different, and so that burning can be very uncomfortable. And so if you're having that, talk to your provider, and we want to have it diagnosed. And so at that point, you have an active case, let's say.
Okay.
There are a couple of treatment options, prescription-wise. There's some medications for the actual virus,
Oh, okay.
antivirals.
Once this broke out.
For an active case,
For an
typically.
active case, there are
And
things you
certain
could do.
patients actually take antivirals long-term if they are significantly immunosuppressed. So sometimes
Right.
cancer patients
uh-huh.
will take antivirals long-term because
Right.
they would have such frequent cases of shingles,
Right.
because their immune system is not keeping it at bay.
Right.
And that's kind of what's happening. When it's lying dormant, it flares up at different times, but sometimes your immune system can stop it. And then
Okay.
but there's other times where I'll tell folks that your immune system's worried about other things, and shingles can sneak in. And so it presents itself usually when you're sick, stressed, immunosuppressed, and with age. There's more
Right.
cases as you get older, because as you get older, your immune system is not working at on all cylinders, so
Sure.
to speak. That's just normal. That's just as we age, our immune system's not quite as strong as when we're younger, and so you usually see it flare up in patients over 50.
Right.
And so, treatment-wise, we talked about there's an antiviral, to help lessen the symptoms, and then also maybe reduce the duration of the active case.
Right.
And there's also some medications for nerve pain that patients can take. And so at that point, usually your case lasts 1 to 2 weeks, and those active lesions, those blisters, will start to fade away, scab over, fade away, and at that point your case is resolved. But
Okay.
that does not mean that you can't get it again. And so
Wow.
it's you've gotten through that case, but you can continue to get it.
Well, Thomas, the good news is if you have not had shingles, there's something you can do about it.
So there is a vaccine for shingles that's been out for 4 or 5 years, I believe, called Shingrix, and that is an inactivated vaccine, so it's not a live vaccine. It won't give you shingles. It's about 97% effective in preventing shingles. It's approved for all patients 50 and older.
Okay.
And so unless you had some allergy to the vaccine
Right.
ingredients, which is rare. And so that's a vaccine that can help prevent shingles. And, when we talk about 1 in 3 folks are going to get shingles, that vaccine is one of the only options that you have for preventing it. Besides, I also highly recommend living a healthy, active lifestyle.
Sure.
Because that's going to keep your immune system robust, and making sure that if you need supplements, there's a lot of immune support supplements out there: vitamin D, vitamin C, elderberry, zinc, and those are things you can take during an active case too.
Oh, okay.
And so I always think anything we can do to support or boost our immune system is important.
Absolutely.
But the vaccine can help prevent a future case.
Now, the vaccine, from what I understand, is a 2-part. Is
That's
that
right.
correct?
So it's a 2-dose series, 2 to 6 months apart. So you get your first dose, and you can get it at your local pharmacy.
Now, do I have to go through my physician, or can I walk into Rocky Mount Medical Park Pharmacy and say, I'd like to get a shingles vaccine, and I
Yep.
can just get it?
You can just walk in, and we take walk-ins. We're open Monday through Saturday, and you actually, for this vaccine, you really can't go through the physician's office. They typically do not carry the shingles vaccine, and they'll carry some flu and pneumonia sometimes, but it's really one that you have to go to your pharmacy essentially to get it, and most all pharmacies do carry it. And so walk-ins are welcome at Medical Park Pharmacy. And so you would get your first dose, and then 2 to 6 months later, you would get your second dose, and then that's it.
Right.
You don't have to keep getting it every year.
Would you remind me, because
Yeah.
I might forget my
Yeah.
second dose,
Yeah.
does your pharmacy call and say, okay, it's time for your second dose of your vaccine now?
Yep,
your
absolutely.
shingles?
So that, when you get 2 or 3 months down the road, life happens and
Right.
things are busy, and so we do set a reminder in our
Okay.
system to give you a call and say, hey, you're able to get it now, and you do
Right.
have a window of time to get it.
Right.
If it gets beyond that 6 months, you don't have to start over.
Okay.
So that's good. But there's not as much data on the effectiveness once you get beyond that 6 month period.
Right.
So if it gets beyond 6 months, we just tell our patients come in as soon as you can.
Right. So
And-
when Thomas's staff calls you, go ahead and get your
Yeah.
second dose.
yeah, because you want to knock it out and be done with it, and then you can have that peace of mind
Right.
that the percentages will say that most likely you will not have shingles again. So
And light effects of the shot, I mean,
sure,
pretty
yeah, well,
minimal.
for the most part, we usually see some soreness,
Mm-hmm.
like with any vaccine, but also occasionally a little irritation, redness at the site.
Mm-hmm.
And a lot of folks will probably remember if they got a shingles vaccine over 5 years ago, it was a live vaccine called
Mm-hmm. Okay.
Zostavax, and you could actually get shingles from that vaccine.
Wow.
And so this is not the case with the new formulation. And so usually just that soreness, redness, irritation, sometimes some low-grade fever and chills. Your body's
Okay.
kind of responding to the vaccine
Yes.
and building up that immune response. So that's usually nothing to worry about. But for the most part, overall, pretty mild from what we've seen with our patients. And that reminds me, so if a patient has gotten Zostavax, so over 5 years ago, you're still able to get this newer formulation
Okay.
called Shingrix.
Okay.
And so Zostavax was only about 50% effective. So you're still rolling the dice a little bit, 50-50 on whether you might still get shingles after getting the vaccine.
Right.
And so it is a recommendation that you can get
Get
the
this
new
newer
one.
version.
Yeah, and the Zostavax is essentially not really available
Okay.
because of the huge difference in efficacy between the two.
Well,
shots.
the difference between getting shingles and getting the minimal effects of this shot, I mean, there's no comparison, it sounds like. So
Yeah,
you don't
we-
want the shingles, let me tell you.
And we always try to just provide information on, on a vaccine or a medication. I'm not a believer in taking anything that somebody doesn't need.
Right.
But when I talk to most people about shingles vaccines, that's one that they're very interested in
Right.
because, like I said, everybody's heard a horror story
Right.
from the
Oh, yeah.
family member or friend or themselves about having shingles. We were just talking about how severe it can be before we hopped on the show, and most people are very interested, and so we'll explain everything about it, and usually the patients are on board with it, but that's what we're here for. Your local pharmacy is here to
Right.
provide that
Well, we
information.
depend on our pharmacist.
And
I mean,
we're
we really do.
accessible. You can call and reach us quickly,
Right.
and so we want our patients to utilize us as a local community
You can
resource.
get a pharmacist on the phone a lot quicker than you can a physician, and that's not throwing any shade on a physician,
Sure.
but they're in a patient's room
Yep.
versus the pharmacist is right there. Now, does Medicare pay for this?
So, yep, great question. And that's one of the reasons why I wanted to talk about it here in January, because January 1st, 2023, there's a new Medicare rule, Medicare essentially legislation or law that requires coverage, full coverage of any typically available approved vaccine for
Oh, wow.
Medicare patients. And so there's no copay if you have Medicare drug coverage for the shingles vaccine. And that includes deductible, and it includes copays, cost sharing, et cetera. So no copay. So if you have Medicare drug coverage, it's going to be covered. And we had a lot of patients that had a high copay before, and they held off on it. So we want you to know that you
Wow.
can get it for free.
That is great. That is great. Well, we're glad to hear that, folks. There's no reason not to go and get your vaccine. is important, and as we said, you do not want shingles. So
Absolutely. So,
great information, Thomas.
well, thank you for having me. And if
Yeah.
folks have any questions, feel free to call up to the pharmacy at 252-443-7979, Medical Park Pharmacy. We'd love to be your resource for any medication or vaccine-related questions, and would love to help.
Well, we're so glad you're doing this, and we look forward to 2 weeks. Thomas will be back, and he'll have another great topic. And in the meantime, we might take calls on one of our shows.
Yeah,
How about that?
I'd love to.
Yeah.
Absolutely.
So get your questions ready, and he will, and you can ask the pharmacist direct. So, as Thomas says, from your pharmacy to your home, Farm to Home is the name of the segment. Thank you for doing this, Thomas. It is a definite community service that Thomas is providing here.
Thanks for having me, Sandra. Enjoyed it.
Absolutely.